Hello, my name is Bredin and I completed my fieldwork placement with the Saskatchewan Health Authority in the Chronic Disease Prevention Management Unit. This unit is composed of a team of healthcare professionals who develop and implement programs to individuals who have chronic diseases such as diabetes, chronic obstructive pulmonary disease, heart failure, congestive heart failure, mental illness, and mood disorders. My initial special project was to develop and implement a home-based exercise program for the COPD unit. After starting my placement and facing a few obstacles regarding this project, it was determined that this was not a priority for the agency at the time. After conversing with my supervisor, Bree Kelland, and his team, it was determined that a type 2 diabetes exercise program was needed. So, for my special project this semester, I completed a project charter for the exercise portion of the upcoming type 2 diabetes rehabilitation program. I began this project charter by meeting with the head of the Metabolic and Diabetes Education Center to determine what the overall goals of the project were. Then I began researching multiple articles and exercise programs regarding type 2 diabetes. After completing my research, I started to write recommendations of what was required for this program to be successful. Following this, I wrote a program description and action plan of what should be happening during the exercise session and how to implement the recommendations. Putting these together, I created a logic model to determine what the outcomes should be if the client were to attend the program. The proposed outcome from this program include decreased overall blood sugar glucose levels, decreased blood pressure, also decreasing emergency room visits, and most importantly, overall increase in capacity to self-manage their diabetes. Lastly, I began to determine an evaluation design. Going back to the research I found, I determined that the evaluation design from the health authority's pre-existing COPD rehab program was similar enough that it could be adapted to this program. This project relates back to my learning objectives as I wanted to gain a deeper understanding of what exercises would best benefit specific client medical needs, as well as learn how to properly develop and evaluate a rehab program. This is a future program that has not yet been implemented, and due to COVID-19, the start date of this program is unknown. This exercise program that I have created is a starting framework for my supervisors as well as future fieldwork students to continue to develop and implement. Although my initial project did not go as planned, I am extremely grateful for the opportunity that I had working with the SHA under this supportive team. This project has allowed me to develop skills including communication and program development. The most important thing that I have learned this semester is that adaptability is key when working in the healthcare field, as healthcare is always changing and evolving.